So I have a question for Mr. Golden, actually 2 questions. So the first question is, are these visual maps or aids guided towards, is like an umbrella under a certain disease, or is it like precision medicine tailored towards a specific person and their specific condition?
Yeah, good question. So we are making these maps adaptable for a full range of different types of conditions. Ideally, we want to use these as early as possible. So if you can think about the memory health areas, doing things like high intensity interval training, Tai Chi, chair yoga, low inflammatory diets, and sleep, anyone at any age will benefit from those kind of types of exercises for your mind. And also, the visual maps that you saw there was probably more an extreme example of someone who's fairly advanced stage. You can reduce the number of steps. You can use them for anything from medication management. So we believe that they're a pretty wide range of people.
My second question is, if these visual maps are kind of independently used, like without the caregiver, like did you ever have an instance where, let's say, a patient with dementia is taking a shower and then that's it, he or she doesn't go back to visual maps and say like, oh wait, what's next? Like that never happens, like it just continues on.
Yeah, so we've actually had some surprising results. That one example of someone who has been incontinent, and she was going basically soiling herself multiple times a day. It was causing a lot of stress on the husband. What he did was he recorded the voice of her daughter, and after using the visual map for 3 months, she now will basically ask, "Where's my daughter?" To the husband when she has to go to the bathroom and doesn't go to the bathroom on herself anymore. So there is an opportunity, as I mentioned, with creating this habit that you can regain that independence that you've lost.
Thank you.
To the left.
Hi, I have a question about the insulin question. It's my understanding that neurons are not insulin dependent for glucose metabolism. So why is insulin relevant in the brain?
Why is insulin relevant in the brain? Well, your understanding that there is no glucose metabolism?
No, that glucose isn't like a person who, let's say they're in a state of hypoglycemia, their brain is still going to function. Their brain is still getting glucose into the brain cells without a lot of insulin, unlike the rest of the body, which needs insulin.
Well, actually, a lot of the glucose is used by the brain.
Right.
And when you start to have mitochondrial dysfunction, where you are not producing as many ATPs as you normally produce in a normal case scenario, then you've got a dysfunction. The question then becomes, can insulin help rectify some of those situations? We don't know yet. We don't know to what extent. One of the ways of measuring brain activity is actually through PET scanning, using flow deoxyglucose. So there is heavy use of insulin, and in an AD brain, there's less use. And the question is the less use a situation that can be remedied or not?
Okay.
Yes.
This question is for Matt Golden. We're case managers at Independence Blue Cross, my nurses and I, and we do a lot of referrals for patients who are, status post, TBI. How would we find any more information? Can we make referrals for this MAP habit when we're, speaking with the families over the phone? They're looking for anything at all, that we can offer.
Yeah, so our MVP is going to be released at the end of June. We're going to be beta testing with a small subset of people initially. So basically, you can go to maphabit.com. We'll have information on how to start using it, and I'll be here in the closing ceremonies too. If we want to talk about next steps.
Mr. Golden, you're very popular this afternoon. Through the years, when my mom and my stepdad had two different dimensions, but they presented fairly kind of the same in certain. One of the things, the safety issue in the home, was my mother was the, she loved to cook, she loved to clean, that was her kitchen. You didn't go in the kitchen when she was there because that was her temple. So as it was clear that she could no longer be left alone in the kitchen, there were two small incidents with food that she forgot I had put on the stove, and also with soap that had fallen. The stove was easy, just take the handles, the knobs off, like you would do when you have small children in the house, and that took it. But the shampoo, the body bath, the dishwashing liquid, it dawned on me, why not go to one of these restaurant supply places and get the ones that operate with a battery? And it solved all kinds of problems. And she thought it was so cool. Just put your hand and everything came out. No faults in the bathtub. At the beginning, when there wasn't a caretaker there all the time, and then of course it was obvious that we needed to have a caretaker. But that alone, I know it sounds kind of banal, those automatic dispensers changed so much for her. And I bring that up because sometimes you're home, you're not thinking commercial, you're not thinking, and every city has those places where the restaurants go and buy in bulk, just for restaurants, not Costco, we're talking Costco, we're talking that. And I've told this to, I don't know how many dozens of families. And at first they were like, really? Everyone who got them changed. And so I think we need, when dementia comes into our lives, thinking outside the box, what is out there, and just look around. And don't worry about the bathroom like being pretty pink and all that stuff. Like, the old-fashioned way of thinking, decoration and all that, that we really have to be practical. And there's so many things that you can borrow from professional environments. And I just wish that, and maybe you can write that book, or some kind of, along the work you're doing, that all of these interventions, all of these things that one can do in the home, because it's not just the Alzheimer's patient, it's the caretaker, whether it's a family member or it is a paid caretaker. And I'm just throwing that out there because no one told me that. After I did it, they would say to me, oh yes, of course. Well now, but I think that I haven't seen, and maybe it does exist, but I never saw like a booklet, something that covered those sort of common sense things that we each find on our own, but they're not all together in one place.
Yeah, you're right. There's so many great techniques that people have out there that really need to be part of a more organized program. I know when I was talking with Kara earlier, she was talking about her book where she does come up with a lot of these techniques and tips for caregivers that are just really critical, and just the smallest little thing can make a difference for someone. So I mean, that's really our goal, is to just start getting enough people using it where they give us feedback on what has worked for them, and we can create a social community so that others can share what works for them.
Hi there, I am Carol Amos. I'm author of the book Hope for the Alzheimer's Journey. So there's some tips in there. But I'm also a volunteer for the Alzheimer's Association. And one of the things that they have are these support groups. So the Alzheimer's Association, other organizations, churches, and that's caregivers coming together. And that's where you get a lot of the good ideas is from finding out how other people dealt with similar situations. So my recommendation would be, first of all, and it's in my book, is that you get connected with the Alzheimer's Association or some type of support group, because it's a difficult road and you can all help each other. So.
Final question? Thank you very much to our panelists. Thank you all for joining us. You're all invited to join us at the closing banquet.